So social anxiety disorder is a very common experience. Social anxiety is a very common experience for teens, and less so for young children, of course, but makes a lot of sense in the context of ASD. You need to be very, I'm assuming everybody understands kind of social anxiety. And the most important part of understanding social anxiety disorder is a concern of judgment, a concern of negative evaluation. That's the most common telling feature of social anxiety disorder, that there is some fear of negative evaluation or worry of negative evaluation. So it's not just about social withdrawal or social avoidance. The social avoidance that comes from social anxiety is the consequence, right? So it really is this concern with scrutiny, this worry. It's not just a fear response to social, it's not just a fear response to social situations, but there's typically a cognitive component where there's an avoidance as the behavioral consequence of concerns of evaluation. So it might be hard to understand about concerns of in kids who are more nonverbal or less verbally able to articulate. And there is a bidirectional relationship between social anxiety and social skill impairments, which makes sense, right? Because if you have lots of anxiety, you're not going to be able to process that social information necessarily as accurately. You're more likely to process neutral information as negative. And have thoughts about situations that are congruent with your emotional state. So you'll find that in actual fact, the radar, if we all have, let's imagine we've got this social radar that picks up on social threats. So we all have this radar. Some of our radars are stronger than others. What shapes that radar? Well, attentional processes shape that radar, right? Having a sense of sensitivity to threat. If I don't have a very good sensitivity to threat, then dangerous things could be in my environment, but I might not pick up on them. That's not good, right? Probably have less social anxiety than I should. But the other thing could happen where I might be overly sensitive to possibilities of threat, when in fact there aren't threats in my environment. That's where we're more likely to experience social anxiety. Many of our kids have, as mentioned before, overly sensitive natures, essentially, very strong radar. So it's overly sensitive but not specific. It doesn't differentiate, right? It's an all or nothing approach to social situations where they're looking for threat like anybody might, but they're seeing threat in places where there isn't a lot. So as a result, if that was the case, it makes sense that they would avoid lots of social encounters. And when you don't have social encounters, then you don't have a chance to practice or to grow your social skills, and we get this negative cycle because you no longer are competent, you feel confident, you experience more threat, and you avoid more. And it's a very common cycle across social anxiety, which makes sense why so many of our kids also have social anxiety. But you need to be aware of what, so one thing to ask about is what is the person's level of social motivation before they started to show the anxiety. Some kids with autism are indeed quite socially aloof. They have very little interest, no interest, they never have had interest really in social interactions with others, other than things that might be motivated to their particular interest, their perseverations. If that's the case, that's not social anxiety. The anxiety for them is that they're being forced to do something they don't want to do. Right? It could be anything. The fact is, what they don't want to do is social stuff. They don't like it. It's uncomfortable for them just because it's not interesting to them. They don't feel but they don't feel worried about it. There's no fear response associated. It's feeling stressed because they're put in a situation that they don't want to be in. Right? So that's not social anxiety disorder as much as that's, again, part of the ASD symptom kind of profile, and many kids might experience that. But other kids will care about peer approval. They will want to have a desire for friendships, a desire for social interactions. So in this and that's probably more of the kids than less, more of the people. And it's in that setting that if they're feeling anxiety about social situations, that's something where we're saying, okay, maybe there is an additional social anxiety because they're motivated for social interaction, right? Part of them wants to be there. The anxiety in some way, and this will come up in OCD, is ego dystonic. And that's an important differentiating feature between anxiety disorders and autism, is to ask yourself, are these symptoms egosyntonic or dystonic? For the most part, anxiety issues are dystonic, which means that from the sense of self, they're not part of who the person is. They don't want those experiences there. It's the presence of them that bothers the person. rather than the absence of them that bothers the person. So another way to say in social anxiety disorder, if they want to be part of a social situation and that's their motivation, but being part of it brings about anxiety, that anxiety is dystonic with their wants, right? That it doesn't fit with their wants, yet they experience it nonetheless. So in that sense, it's very common that would be social anxiety in somebody with autism, even if they have impaired social skills, right? Be careful, though, that sometimes a person might have limited social motivation, which would be like the socially aloof person, right? But that might be actually a coping mechanism, right? So it might be who they are all the time, just part of their personality, part of their ASD, fine. But don't only see it that way. Find out whether they've experienced considerable rejection, whether they've been isolated, where they showed some attempts at being involved, and for maybe kids, not for evil reasons, but for very natural reasons, they weren't successful, and a result is that they're socially immotivated and they feel social anxiety, be about to put in that situation again. So you can get, like always, there's not an all or nothing, but you can get both. So the question around social anxiety is a question of motivation. It's a question of dystonia or syntonic or dystonic experience, right? What they want and how the anxiety clashes with what they want. And it's a question of whether if these are natural reactions to rejection and failed past attempts. There could also be, this is what Susan White often talks about, what they call atypical manifestations of social anxiety. So you have to look relative to, they counsel, the person's level of social difficulties. It can't be social anxiety relative to what you would expect for somebody who's very socially able. It might be more subtle social anxiety for a child who already is struggling and naturally is not very inclined to be in social situations. Is there an excessive fear of negative evaluation? Can you get that flavor from your interviewing, from your observations? There really is a fear response associated with social anxiety rather than typically an annoyance related to the presentation of social stimuli. So a concern, a checking, some of those reactions of reassurance seeking, these are the kind of pieces that we look for to see whether anxiety is actually present. So here's a number of potential reasons behind avoidance of social situations that are quite common. Remember that it needs to be avoidance to social situations because of the social aspects of the situation, rather than the avoidance of social situations for some other reasons, like a lack of interest in situations, or avoiding a social situation because things are too sensory in the place. Kids are too loud, and I don't like the loud things. Right? Or being disinterested, like I talked about being aloof, or uncertainty. Maybe that avoidance is actually related, just like it could be to avoiding dogs, because I can't predict what dogs are going to do next, so I avoid them. So in this case, the uncertainty is about the social situation, and so I avoid what's uncertain to me. Right? It's still anxiety that they're feeling, and it's still avoidance, but it's actually not specific to social content. Right? The socialness is what defines social anxiety. There is often a fear of negative evaluation, and our kids very commonly articulate a fear of failure, a fear of being seen as a failure from others, right? Not wanting to appear like a failure, this kind of push for perfectionism. So ask questions about what are you afraid is going to happen if? What do you think your child's afraid of? Do they ever tell you? Have you seen anything where they're afraid of something, right? Ask specifically about fear to see if something comes up. And there is a subgroup, really interesting, that actually becomes afraid of positive evaluations. Imagine a situation where you struggle with social skills and you've had a lot of negative experiences and that's what you're used to. But then all of a sudden you learn something, you grow a little bit, a light bulb goes off, maybe you find the right kind of environment now because all of you are a little bit quirky and kind of, you have a license, so people really want to hang out with you that much more, right? Things kind of shift a little bit more, right? And all of a sudden people want to be around you and they're making eye contact with you and they're actually asking you questions and they're giving you approval, like high fives and a pat on the back, right? You could get a fear of that positive input as well. So that's something that's rather unique to the story of first being used to failure. right? So that's kind of an atypical manifestation where the story, the content actually might feel odd for you at first because the content's actually one of success, where they actually have a negative reaction after getting applause on stage. They finally mastered it, they came up on stage, yeah, everybody's kind of cheering and rooting them on, and then they start to have these kind of fear responses, okay?